Hi everybody, I'm Lee, this is Bridget. We're from King Harvest to kingharvest.org. We're going to ask and answer a couple of questions that we've been hearing lately about a syndrome referred to as Tourette's.
The first question is, how can cannabis help with Tourette Syndrome?
It's very helpful with that. So Tourette's, one of the main features is the involuntary verbal, right? Almost like a tic, right? So cannabis oil, specifically CBD from the AC/DC strain, and then indica from what we use as Granddaddy Purple.
Right.
In very low microdoses, it'll knock down inflammation, and it's going to slow down the processing in the system, and it's going to give a patient a half of a second in between that outburst or before that outburst.
Right.
So where in many cases you can reverse or control the outburst with Tourette's.
Right.
Right.
Okay, so can cannabis help with motor tics?
Yes, with Tourette's it's verbal. With many types of spectrum disorders, you have stimming,
Right.
all kinds of different kinds of facial tics, hand tics, pattern repetition, that
Right.
kind of thing. So cannabis oil, by virtue of relieving the anxiety in the patient and knocking down the speed of the processing, it seems to realign everything and allow the patient to resist those urges,
Right.
to tic or to stim, right, or to have an outburst, right. It allows them to process more at the speed of life, and to be able to process information and give information in a way where they're much more present.
Right. Okay, good. So the next question is, can cannabis help with verbal tics?
Well, with Tourette's, that's what we see, right?
Right.
That's
That's
the main
verbal outbursts.
Yeah, that's the main feature. So yeah, it's going to allow a patient to resist that. In a lot of cases, it'll go away altogether. Yeah. Uniquely in the case of autism, it seems to have an opposite effect, where people who are nonverbal will then become verbal again, which is really wonderful. Fantastic. For families. Yeah.
Right. So the next question is, can cannabis help keep with Tourette's-related self-harm?
Yes. So as an antipsychotic, right? So a lot of times patients that have spectrum disorders, when they're meeting the intersection between having that spectrum disorder and their adolescence or their changes in their hormone structure and so on and so forth, there's a lot of frustration. There's a lot of inability to communicate, or fear of communication. There's a lot of self-consciousness and lack of ease in social situations and so forth. So people get really frustrated, and you'll see outbursts, not just verbal, but people will start to cut or start to physically injure themselves. And so cannabis oil is going to knock down anxiety, create relief, knock down inflammation, knock down self-consciousness. It's going to create a basic core sense of calm that's going to allow a patient to resist those things, and if ever even getting in that negative feedback loop in the first place. Right. So what I see happen from first-hand experience is that once you break that feedback loop, it stays broken, right? And if it starts to pick back up again, you have the medicine on hand to knock it back down. And you can keep somebody, out of their tree, if you will, once you start to see the small symptoms. It works the same way in a Tourette's patient as in an autistic patient, or as in a seizure patient like myself. There are triggers, and there are warning signs, and there are call signs along the way.
Right.
And you can read those things just like you're, out on the ocean, like piloting a boat. And then once you really start paying attention, and you can dial it in when you understand the way the 3-bottle set works for Tourette, it's really profound. It'll life-changing.
Okay, so the last question is then, what is the best method to ingest cannabis for Tourette's?
That would be subjective, but in our opinion, the most reliable and effective way is to be taken in drop form.
Right.
So through a dropper bottle infused into organic MCT coconut oil, no sugar, organic, lab tested, all that. It'll take about 45 minutes to an hour to hit you. Right. It'll last for 6 to 8 hours. It's the most effective way to medicate somebody with Tourette's, because you can do it very safely. The drops are microdosed, they're very light. And again, the medicine will last for 6 or 8 hours rather than inhaling, which lasts for 1 hour. So you can send a patient to school without worrying about them needing to come home and remedicate. so they can actually go to work, they can go to school, they can go about their active life, or discover an active life,
right.
like when they're actually sort of trapped in the prison of their disorder right now.
Right.
They can manage their symptoms and they can venture out into the world and actually have some quality of life. I speak from firsthand experience. So, thank you for listening, everybody. My name is Lee. Again, this is Bridget. We're here at King Harvest and kingharvest.org. If you think that we can help, please feel free to give us a call at 877-469-4584. We're happy to give you all the attention and time you need, free of charge, right? Never any obligation. Happy healing, everybody.
Happy healing.
God bless. Hi, everyone. This is Lee from King Harvest and kingharvest.org. I wanted to take a moment and thank you all for watching. If you like this video, please go ahead and subscribe or click on one of the videos to your right. Further, if you have any questions or comments, go ahead and leave them below. You can also visit us at kingharvest.org. Thank you again, and happy healing.